that health is outside of you. It's not, it's all inside. You don't just lose faith in or confidence in the doctor or the peptide or the supplement. You begin to lose belief that your body can actually heal. And that is the heart of the issue. What if we just sat still for 30 seconds and just noticed without judging, without giving meaning to what it is we feel, to just sit?
What if I told you that the same mindset that builds championship teams also builds an extraordinary life? This is where peak health meets peak performance, where we explore the science of longevity and the mindset of greatness. Because your legacy isn't just what you leave behind, it's what you show up with every single day. This is the Legacy and Longevity Podcast. I'm Zach Dancel, your host. Welcome back to the Legacy and Longevity Podcast. I'm your host, Zach Dancel. What if the symptoms that you've been told to simply just live with were never real problems? What if the signals pointing towards something deeper? My guest today has spent nearly 2 decades asking these exact questions. Dr. Randy Michaux has a plethora of experience handling these, and it's not funny, but it's very close to my heart because a lot of the things that he focuses on, my mom personally went through, right? And my mom obviously is the reason why I'm in this health space, the reason why we founded and started NAVA. He deals with total body wellness. He's the founder of the Total Body Wellness Clinic in Meridian, Idaho, practice known around the world where they handle the complex cases that most doctors would give up on. Lyme disease, mold, parasites, heavy metals, the conditions that leave people bouncing from specialist to specialist. And I keep kind of going back to this, but that story sounds a lot like my mom. So Randy, I'm super excited to dive into this because of just how near and dear this is to my heart. But welcome to the show.
Thanks for having me. I'm so glad to be here.
So before the clinic, right? Before the credentials, who were you? What pulled you towards the calling of healing?
They're kind of, thank you for that. They're kind of two stories. The first one, by training, I'm a chiropractor, and about a year into practice, I started losing weight, not intentionally, right? My frame, I'm about 6'3", between 185, 190. So I don't have a lot of weight to lose, but I began losing weight, a couple pounds at a time, didn't think much of it. My digestion really seemed to be way off. I wasn't able to hold anything down. I was eating, but it just was, I could see my food. I knew exactly what I ate as it came out. And I was in total denial. I'm fine. I can just exercise my way out of this. I'll work out more. I'll work out harder. I'll push myself more, and I can just power through this. But the pounds kept on coming off. 5 pounds, 10, 15. Ultimately, I lost about 32 pounds. And my pants weren't fitting. My clothes looked terrible on me. And my wife is like, what's going on? And I'm like, I don't know. Like all the adjustments, all of the basic nutrition that I knew, it wasn't helping. And my mom had mentioned a naturopath to me, which at first I'm like, whatever, I don't need that. But you get to a point where it's like, you know what? I don't know what else to do. And so I began seeing her, and she introduced me to the concept of drainage, and meaning that our liver, our lymphatic system is essential. And if that is not moving, then we're not going to eliminate well. We can't process toxicity well. And she said, yours is completely stuck. Your liver is a disaster. And here's why. She's like, there's mold in your body. There are parasites. There are elements of Lyme disease. There are heavy metals. And I'm like, where'd all this come from? Right? Still in denial. Like, I've never been out of the country. How do I have parasites? And she's like, they're all there. She's like, here's the proof. And I was like, fine, I'll do whatever you say. and I began working. It took me about a year and a half. Slowly, I began to recover my health. Ultimately, at a year and a half, 2-year mark, I gained all my weight back. I was digesting. One thing I didn't mention is that I had had chronic migraines from the age of 12 up through 32. And they got increasingly worse to the extent where I would have to close my practice because I couldn't function anymore. I could not work while having this nausea, searing head pain. And what really did it for me, what got me to go to her, was I was adjusting a patient and I literally had to run out of my office and I just vomited all over the ground. And that was kind of the point at which this is ridiculous. You've got to take more control of your health. And that led me to her, which then led me to healing. But I kind of went back to just doing chiropractic, right? It didn't move me into this space of functional health until my dad died. He died of cancer, was diagnosed in July, died in September of the same year. And that was a catalyst for a lot of change, a lot of guilt, a lot of remorse for not really seeking out greater understanding of health and nutrition. And from that, I met Dr. Todd Watts, who started the company Cellcore. He is actually the founder of Total Body Wellness. He sold me the clinic a few years ago. And I began shadowing, watching, conversing with him. And he introduced me to this world of parasites, mold, Lyme disease, and the sequence by which to support people through that. And that led to some massive transformation in my family. He helped heal my sister, and then ultimately asked me to come work with him. And so I moved cross country from Virginia to Southwest Idaho. And now for the last 8 years, my world has been in this chronic illness state of working with very complex cases and helping people to build a roadmap to know how to navigate this space.
Yeah, no, it's have a deja vu because everything that you're saying, I mean, it's very similar, right? Because my mom had mold toxicity, but we didn't find that through traditional medicine. We found that through functional medicine. My mom had Lyme disease. We didn't find that through traditional medicine. We found that through functional medicine, as well as a bunch of other autoimmune diseases that her body could no longer handle. Functional medicine, right? We kept coming back to functional medicine as, you did, right? Talk to us a little bit more about why functional medicine is a little bit different when it comes to truly understanding the complexity of Lyme disease, mold toxicity, parasites. Why is it being missed in traditional medicine? Why is it that functional medicine providers, naturopaths, why are they able to figure it out and modern medicine's not?
The way it was explained to me from another colleague, he said, in medicine, you're looking to make a diagnosis, right? So you're taking the symptoms and looking at, okay, what's causing this symptom? And the only reason that you're getting a diagnosis is so that then that can put you through the prescription route of knowing, okay, here's the medicine you're going to take for this specific diagnosis. But there's no looking outside of that. It's here's the diagnosis, and then here's the medication. And then if that doesn't work, here's how we escalate different medications for that one component. So if somebody comes in and they have irritable bowel syndrome, well, they're going to do tests to identify what's going on in the gut. And they'll identify, hey, you know what? You have irritable bowel. Here's the medication. If that doesn't work, here's the next medication. Whereas in this space of whether it's naturopaths, functional medicine doctors, holistic doctors, we're looking at, hey, what's the underlying cause? right? Because if I stick with the gut, irritable bowel, other things that escalate, distension, bloating, these could all be triggered by other pathogens. These can be triggered by parasites. These can be triggered by mold toxicity, biotoxin illness. Lyme disease can trigger these things. So if we just stop at a diagnosis, we're missing the entire other symptoms that a person may be having. So there has to be exploration. Okay, so you're experiencing problems with the gut. What else? Right? What else can be associated? What else can be related to it? And it's like putting a puzzle together. And this is where, I won't say all, but this is where the really good people in the functional medicine space, the really good docs, start to ask multiple questions. And then you look at, well, what does this sound like? You know what? A lot of your symptoms sound like they're related to parasites. A lot of your symptoms sound like they could be related to mold. And then based on that, you can identify testing, right? To prove your hypothesis. You can be curious. You can have them do different assessments to establish, hey, what may be there. So ultimately, I guess the real difference is curiosity. Curiosity to understand the person sitting in front of you. Curiosity to want to develop a relationship with that person in a way that they can reclaim the health that they want. Without that curiosity, everything stops at here's your diagnosis, here's the medication.
Yeah. Well, I mean, the system isn't built for curiosity, right? It's hard to be curious in a 7 to 10 minute appointment, to ask those series of questions, because as you and I both know, in functional medicine, appointments can be 30 minutes, 60 minutes, some 2 hours, depending on the complexity, right? You don't have that type of time in traditional medicine because it's not built that way. The providers just, unfortunately, whether they want to or not, insurance isn't going to participate in that.
Yeah.
And we personally dealt with that for a few years during COVID. But to your point, right, the definition of medicine is diagnosing, treating, prescribing medication based off of a medical provider's knowledge and opinion. Says nothing about running diagnostics, right? It says nothing about true discovery of asking questions like, tell me about your nutrition, tell me about your exercise, your sleep, how do you manage stress? So it's, it happens to so many people.
Oh, it does. Yeah.
That unfortunately just aren't getting the answers that they need. So, kind of going back to, so you moved to Idaho, right? You changed from being just, do you practice chiropractor anymore?
I don't. I'm not. Yeah, I still say I'm a chiropractor, but I don't adjust anymore. It is 100% working with people either over Zoom or in person, but I'm not doing chiropractic anymore. It's all in this space of chronic illness, functional medicine.
Yeah. For the patients that nobody can help, right? What is it that they have to do, or if they're listeners and viewers, what is it that they have to do? What's the first step for them for truly seeking help, right? They're constantly being told, oh, this is normal with the aging, or, oh, there's nothing that we can do, take this medication, but something in them feels like there's something out there. Because where do they start?
Yeah, that's a great question. I think this can be challenging, right? Because many people have been to 5, 10, 15 doctors, and they feel like, I don't want to start over. The way that I work with people is, as I listen to the words, the tonality, the body language, that often paints a very clear picture of what's the internal dialogue. I think that if we separate the soul from the physical symptoms, we're doing a disservice to the person. We have to look at them as an entire person. And so if someone's had chronic illness, there's a trauma to that, right? And trauma can be very like, I don't like that word, or I've never had trauma. Well, we can call it a sympathetic response, right? That fight or flight response, or being frozen. I don't know what to do. My body just feels like it's completely locked up. And so I think the starting place is understanding like what's going on inside, because we're so quick to experiment. And when I say experiment, just reach for the next protocol, reach for the next supplement, reach for the next biohacking piece of equipment that is outside of us, that is going to then hopefully heal us. People spend a lot of money doing that. I like to have people like, what is your internal dialogue? What do you actually feel? What's going on inside? And when I say that, it's not just, well, I feel sick. It's more of a, okay, what's the energy behind that? Where's the fear? Where's the anxiety? Is there depression? Is there hopelessness, despair? Because each of those words and emotions, they track with how long someone has been stuck in a sympathetic space, right? They also track with what's called cell danger response, which is the way that the body, the mitochondria, shifts in response to danger. And anger and fear are part of that sympathetic place. But then you escalate into despair, disassociating, hopelessness, guilt, shame. And understanding that internal framework and accepting, oh my gosh, like this is where I'm at. I think that acceptance and awareness of what someone is feeling is number one. Because if you can't begin to move from a fight or flight response into a healing place, whether that's with breath, whether that's with meditation, whether that's with different modalities that can help that, like you can't heal in a sympathetic dominant place. So where do people start? Internal evaluation. Where am I at? Am I frozen? Am I stuck? Am I anxious? And how deep does that go?
Where would you start? Or how do you begin to rebuild someone's trust in their own body and in this idea that healing is even possible when many have been told that their symptoms were exaggerated, they're in their head? Obviously, that type of dismissal to a person goes far beyond just physical illness, right? It does have a whole mental, emotional, psychological aspect to someone who's already down, right, with their illness. Now just kind of being kicked down even further. So how do we build the people's trust in their own body? Because I agree with you, right? Our bodies are the most special, amazing invention ever, right? It literally will tell us when something's wrong. It'll send us signals. It'll send us messages of, hey, I don't like this. We should figure something else out. But where do we start to where we can then trust ourselves? Hey, let me follow this message.
I think as the doc sitting on the other side of the camera or the other side of the table, it starts with listening. Do they know that I'm actually listening? And can they sense that I'm listening, not to seek to make a diagnosis or not to tell them what they have to do, but can I listen to understand? And And then it's reaffirm, is this what I'm hearing? Is this what you're saying? Is this what you're experiencing? And I can't tell you how many people have been like, you mean you believe me? I said, why wouldn't I believe you? Like, this is your experience. And in some cases, I've had people start to cry because it's their first time that they've actually been heard. And for others, they're like, I'm just kind of in disbelief that like you're accepting of what I have felt because others have told me it's just in your head. And I'm like, well, whether it's in your head or not, it's your experience, right? So I think that's number one. We have to be good listeners, and I have to be able to repeat back in my words, this is what I'm hearing. Is that correct? That's one. I think the second part is we've become so disassociated with our body. People have been told so long that healing is outside of you, that your body just has lost the capacity to heal. And that's why you need a medication. That's why you need a drug, because your body can't do it. What if we just sat still for 30 seconds and just noticed without judging, without giving meaning to what it is we feel, to just sit, right? My wife was leading a group that I lead, and she was doing this, and she said, let's just sit for 30 seconds and let's just notice what we feel. And as you notice, don't judge it or give meaning to why is it there. Just feel. And it was fascinating. As I sat there and just felt, I'm like, wow, okay, my ankle hurts. I've got a little bit of discomfort in my gut. And then very quickly, my brain's like, well, why is that there? I'm like, no. That's not the purpose. It's not to figure out why. It's just to notice. And so I think this is step number 2 with working with people is, what do you notice in your body? And don't worry about the meaning or don't judge it. Can you feel? I want to get people back into their body, back into feeling, back into having a partnership with their own body, which is scary because many feel like their body is failing them. And so it's like, that's the last place I want to be. And this is the only body we get. So if we can learn to interpret and understand what it's even signaling to us, then I think that's the second place. It's this awareness of what is my body communicating? And then we can start to make meaning of it later. But if we can't get into our body, I don't believe that we can heal. So as I work with people, it is that. It's listening. It's reaffirming. Here's what I heard. Is that right? Clarify this. Clarify that. You said this word. You said this phrase. Elaborate on that for me. When was the first time you felt that? When was the first time you experienced that? And you start to create this web of, okay, this is not just here and now. This maybe goes back to your childhood. Maybe this goes back to in utero. Maybe this goes back to stress that your mom had when you were in utero or even beyond. And you build that, and then you start getting them into their body little by little. And then maybe you start to say, okay, here are some things that I can have you do or take, but we jump to what I can do and take way too fast.
No, and I think that leads us into, the next topic I want to talk about with you, right, is your core belief, right? And that our body has this innate ability, capacity to heal when we remove obstacles, right? And I think the first part of that is, our nervous system regulation, right? The constantly on the go, constantly high levels of stress, constantly in this fight or flight. Walk me through what that actually means in practice.
That's a great question. What that means to me is, can we sit down and have a meal without a screen? Can we sit down? And I start with eating because this is one of these fundamental things that we all have to do. We've all got to eat, but we're even so disconnected from our food in the process of eating. So my question to you is not to you, Zach, but like to the listener, is when was the last time you sat down and you paused before you ate, you breathed and you smelled your food, you started to salivate, which is which is your nervous system saying, "Hey, I'm ready to eat. I'm salivating." The digestive process is starting. And then when we ate, we didn't look at a screen, but we were chewing and having conversation and taking space between each bite, as opposed to eating on the go, eating in front of our computer. Man, I've got so much work to do. I've just got to like plow through this and just scarf the food down, not even thinking about what's going on. And then a half hour later, wondering like, man, my brain doesn't feel good. I'm bloated. So that's a place to start. Something so simple. That's free, right? Sit with your food. Another is, what do you do the first thing when you get up in the morning? Do you go to your phone? I mean, it's so easy. It's right there. For many people, it's their alarm. And so you pick up your phone, you start going through messages, and already now your body is at this like heightened sense of it's elevated. How are you going to come down? Because the day is typically not going to get less stressful. It gets more. What if you started your day off for even 5 minutes of just sitting in silence, noticing what's going on, or step outside, look in the direction of the sun, right? Allow the sun that is healing, that it provides a lot of information to our body. It can reset our circadian cycle. Go just stare in the direction of the sun for a little bit. Just be. This is how I think we build capacity in our body to begin to heal. And these are very simple steps. They're embarrassingly simple steps, right? It's like, oh yeah, I know I got to eat. I know I got to chew my food, but we don't. And we got to remember, your stomach doesn't have teeth. So if we're just scarfing, I go back to food, because if we're just scarfing food down, if we follow this trail for a second, so our body is in a sympathetic fight or flight response. Who wants to eat something when they're being chased by a bear? No, I don't have time to eat. I just want to run. But that's what we're doing. So we eat, right? Our stomach does not have it's not prepared to receive that food. So there's no acid, there's no enzymes there. So what happens? Your body now has to bring in fungus and bacteria to ferment and start to break down that food, which leads to more fluid and indigestion. If we take that a step farther, that then creates a great habitat for opportunistic infections. Your body's not going to absorb. It's not going to digest and assimilate. So you're already having a hard time digesting. Now you're not assimilating the food, so you don't have the energy to go throughout your day. So now you're exhausted and tired. Now you're not sleeping well, and it just cascades, right? All of that just from eating. So why don't we focus on those embarrassingly simple foundational pieces before ever going to a supplement stack, a cold plunge, red light, sauna? There's nothing wrong with any of those, right? But if we can't get these truly foundational components into play, we're not putting our body in a place where it can actually heal.
No, I think I love the how you just broke that down, right? Something as simple as us sitting down to eat, not preparing ourselves to take in that food, right? Being in a parasympathetic state where we're engine is high go, our body is not prepared to digest, break down the food, utilize the nutrients properly to give us that energy, right? And then the cascading effect. I think that you outline that so simple, yet we have such an issue with it. But I think what you really brought to light is just how what seems so simple plays such a large impact on our overall health, because it's not just about not having the nutrients, the protein that come from that food, but then how it impacts your energy, your sleep, your recovery, that then lead to other health issues and symptoms.
Can I say something else?
Yeah.
We look at how from a long-term base people have healed, right? We've healed in circles, not in isolation. So what do I mean by that? If you go back to 200, 300,000 years, going back to Paleolithic man, right? People healed in circles. They ate in circles. They conversed. They talked in circles. We have circles of family, of community. Maybe not everyone has family, but we have community, and yet we are so isolated because of fear of being seen, fear of not being heard, fear of many things. And yet, again, something that is just in our DNA, our makeup. We need community. We need community where that space can be held, not to like prove or perform. And I think of the movie My Big Fat Greek Wedding, right? Old movie, but they ate and it took hours to eat, right? I get that that's not every Italian meal, but with a lot of the friends that I have, they're like, yeah, we have a big meal on Sundays and it takes like 3 hours and we're sitting, we're conversing, we're laughing. It can be like, there can be some yelling, but it always gets back to we love each other. And it was a great experience. Now, we don't all have 3 hours to eat. But the point is like, it's community and it's being, it's presence, it's taking time. And yeah, we can say, well, easy for you to say, you probably have all the time in the world. No, I don't. Right. But we have to make time for these things to happen. So I would say community is another fundamental, foundational piece of healing.
Before we continue, I want to share something deeply personal. The real reason my family started Nava Health. Over a decade ago, my mom was on her deathbed. Her organs were failing, and the doctors told us there was nothing they could do except keep her comfortable. In that moment, everything changed. We realized traditional medicine had limits, especially when it came to proactive and preventative root cause medicine built for long-term health span and lifespan. At Nava Health, we take a data-driven precision approach to longevity. We test over 90 biomarkers to uncover exactly what's happening inside your body, and we build a personalized plan designed around your unique biology. Because fatigue, brain fog, weight gain, they're not random. They're signals. And when you listen, your body can heal. This is functional longevity medicine done right. Comprehensive, proactive, and built to help you feel and perform your best at any age. Go to navacenter.com and take control of your health today. Now back to the show. I love that you say that, because I have 5 key pillars for foundational health, which are your basics of your nutrition, exercise, sleep, stress management. And the last one that I always talk about that I think isn't talked about enough is community. Just having a place where you feel you belong, the sense of purpose, where you can laugh, you can love, that not only just the good things, but also that community that is willing to hold you accountable, right? To the things that you say you're going to do. Like, hey, you told me you were going to go to the gym today. You didn't show up. What's up? Or like that type of accountability, in my eyes, is a healthy accountability, because that's someone that's looking out for you, doing something. If you need a day off, it makes sense. But also someone who can say, hey, you shouldn't be eating that cheeseburger, right? Remember, we said we were going to stick true to this diet. Let's do this together. But talk to us a little bit more, in your eyes, as to how community can really have an impact on our health.
I think first we have to understand like isolation. Like, what does isolation do? We all went through COVID, right? There's not a soul on this earth that didn't go through COVID. And what did that feel like? There was fear, there was anger, there was rage, there was scarcity. Those were real things, right? I was here in Idaho. It was beautiful. I was able to go out hiking almost every week because it's wide open. But there are people in New York City who are bound to their homes for a year. I know people in Canada who are bound to their homes for like 2 years. They really couldn't go. They couldn't go out and live normal. So I'd ask you, how did that feel? Right? Do you look back at that time fondly, or do you look back at that time like, I don't know if I've ever recovered, right? I know that some people haven't because of that isolation. So if we recognize that isolation created a lot of problems, health problems, anxiety problems, fear, kind of changed the whole fabric of how we interact. And now there's a lot of judgment, right? You just look on Facebook and someone posts something and like, hey, the sky's beautiful today. No, it's not. There are clouds. No, it's not. There's this. We're so quick to judge. And I think a lot of that is this fear response, trying to protect self. So then when we speak of community, it is finding people, sometimes like-minded, but it doesn't have to be. But it can be people that are open, that are curious, that are accepting. And I have some patients that they're like, I don't have that. They're like, I don't know where to turn. And I said, well, I'm here. And if I know where you're living, I could introduce you to some people that potentially you could have a community with, right? Maybe it's one other person. Maybe it's another chiropractor that I know. Maybe it's someone else that I've worked with in the past that felt isolated too. But it's being open to being vulnerable with people, not judging other people's experience. And it does take something to seek out. It doesn't just come, right? And this can be exhausting for people. And I totally get that. Like, I don't have the energy to do that. And I understand that. There are groups even on Facebook, as toxic as a place as that can be, but there are groups that are very understanding, that are very open. And it's like, come share. Here's the invitation. So community is there because we can witness each other. We can hold space for each other. Just knowing that someone else understands and that someone else is there and saying, hey, I have nothing to say, but I'm just here to support you. I mean, that goes a long way. And looking at it from that perspective and seeking and finding something like that, just the acceptance. I'm accepted as I am. I'm accepted for who I am, with no pretense of you should be doing this or shouldn't be doing that. He says, where are you? And let's just, sit with each other, right? It's a hard thing. It's a beautiful place when we find it, though.
It really is. And there are studies out there, and to your point, in terms of isolation, if you want to reduce and shrink someone's lifespan, let's put them in isolation. It's crazy. But to your point, to hold space for each other, to have someone that believes in you. I mean, when I was a kid and I was playing sports, my parents used to tell me all the time how, go out there, give it your best. And the fact that they told me that they believed in me, I mean, that gave me so much power. I mean, I felt like I can go out and take over the world as a 10, 11, 12-year-old football player. And they still give me that support today, right? Which is still why I feel like I can take over the world, right? Because I have that strong support system. I have that community that I can share space with. I have been someone that has been not as vulnerable with a lot of people. I have a very small circle, and not to say that's right or wrong, right? You don't need a large community in my eyes. It can be a small knit group. That's your community, right? As long as you have that, that's all that we're really saying here. It doesn't need to be 20, 50. I mean, it could be a handful. It could
It could
be a
be
couple.
three, right?
It could
It
be
could be
three,
three or
right?
four. Like it can be
I
small.
have
Yeah.
4 that to me, is all I need in this world. My wife and my 3 kids, right? Obviously, my parents, my siblings, my close friends. But as long as I have my 4, I feel like that's all I need, and I can accomplish everything with them and for them. So I love this talk about community. I think it was much needed to have because not a lot of people talk about it. But it's a big part of the picture as well as so many other things, right? You know, you treat the whole person, right, at your practice, and we treat the whole person as well. Talk to us about why you can't separate your physical, your environmental, your emotional. Why can't you separate those? Like, why can't those be siloed? As you know, in modern traditional medicine, there's these specialists, you know, that are so hyper focused on one thing. Why that's wrong in terms of long-term health, right? Obviously, there's a time and place for specialist emergencies. You know, you have a heart attack, you need a bypass, you know, whatever it might be, you need a stent put in. You want to go to a specialist that only focuses and does that all day, every day, right? Great time and place for that. But in terms of long-term health, treating chronic illness, why do all of those need to be combined? Why does all that need to be part of the picture in this equation that we're trying to solve in terms of healing and long-term health?
So I think we have to understand our how our brains develop, right? And we have to go back to our formative years, ages 0 to 7. The brain is wide open in that time frame. And what I mean by that is everything that you hear, everything that you experience is real. It's not like when you're 20 or 30, something happens and you can say, oh, that was because of this, right? I'll share here's a real experience, my own experience. And this hits to why you can't separate those. When I was I was 5 or 6, I was sitting at the big stove, potbelly stove, with my dad. And I was a curious kid. I love playing in the woods. I spent so much time in the woods. My parents gave me a lot of liberty at the age of 5 or 6 to go play in the woods. I reached out and I touched the stove. Now, it wasn't the fact that I burned myself that was the issue. It's what happened next. My dad, former Marine, right, was in Vietnam, did force recon. So everything that I understand about him now was about safety and protection and not doing stuff that could get you killed. I didn't know that as a 6-year-old, a 5-year-old, no clue. He either tapped me, probably hit me, tapped me. I wouldn't say hit. It was probably tapped me with like a spoon and said, that was stupid. I interpreted that as I'm stupid. And this was an experience that I recently had that helped me go back to that memory. And then I was able to recognize, oh my gosh, that's when I started hiding things that I thought were stupid from my parents. Going off of a jump, hitting a tree, cutting my stomach a little bit, right? Coming home, like, what happened? Oh, you know, something was in the road and I slipped and I just fell. I didn't want to tell them that I didn't see that there was a tree in front of the jump. That was stupid. There were other things like that. And that has compiled my entire life to where I stopped asking questions, because if I don't know the answer, maybe I'm stupid, right? What did I need in that place? In that space, what I needed was acceptance. I needed a hug. I needed to be told, hey, you know, that can burn you. Totally fine to be curious, but just know some things can hurt and some things can harm. And here's a hug. I didn't get that, right? So what happens? I start hiding things. I stop asking questions. I pretend like I understand what's going on. And what happens in your gut when you don't feel, when you're nervous? What happens when you're anxious? What happens when you are sitting in that board meeting and you forgot to prepare and you know you're going to be called on? Is it just a mental experience, or is your gut just churning? Right? All these things get imprinted on us, and it's almost like a energetic signature that gets stuck. What if that was the thing that created a weakness in our immune system that then opened up opportunities for other illnesses to happen? Fear, right? Fear is a huge thing that lowers our immune function. It puts us into that sympathetic space, and we become a great host for, again, these opportunistic fungi and bacteria and viruses. And so now we can catch, I don't think we catch viruses, but things can be activated in us. And now we're sick. Now we're not pooping. We're not eliminating. So mom takes us to the doctor. Hey, little Johnny, little Randy's not pooping. What do we need to do? Oh, here, take this drug. Oh, it's not working, right? So, oh, well, here's the next one up. Take this. No one ever asked, hey, what's going on? Like, how do you feel? And would I have been able to describe what was happening? No, I was a kid. I had no idea. But the relationship is, if we don't address those imprints, the actual, I think, the true foundation to why our health begins to deteriorate, then we're not doing the body justice. And yes, there are times, Lyme disease, mold, parasites, right? They're huge, and we need to address those. But if we don't get to the core of what lowered your resistance in the first place, was it because you were exposed to a toxin, or was it because you weren't held? You didn't feel love. You didn't feel seen. So then that created this whole internal dialogue and environment where you were living in fear. And because of that, it changed how your heart works, it changed how your immune system works, changes how your brain works. And from that experience, it wasn't long after that I noticed little headaches, right? That was about 5 or 6. 12 is when I really first had my first migraine. But there were little pieces before that of constipation, of, hey, my head hurts. I don't want to tell anybody, because if I do, like, again, what if I'm stupid? I just won't share that. So I'll hold it, right? I'd go like 3 or 4 days without pooping as a kid. And then it's like, okay, now you just got to poop because you feel so uncomfortable. I wouldn't tell anybody. But that had a huge role in why the migraines happened, because of the gut-brain connection and the bacteria that's impacting the gut that is now impacting the brain, and then creates this loop via the vagus nerve and affects other places in the body, which then led to me losing weight, which led to me being a great host for parasites, and on and on and on and on and on. That's why we can't separate them, because they are so interlaced, and they're one. Now, is there a sequence, and is there an order, right? If someone comes in and there's like acute Lyme disease, you know what? The last thing they want to hear is, hey, what's the emotional component to this? That's not what we want. Like, it's like, hey, we need to treat this. We need to jump on this quickly with whatever that is to bring the symptoms down so it doesn't become chronic and go neurologic. But if that's all we do, we're missing and doing a huge disservice to the person by not exploring the many avenues of what health is.
No, I mean, that's one of the biggest problems that I have with all these peptide pop-up shops, all these hormone clinic, because they see it as a opportunity for business. I do think when utilized in the right, proper way, it can be life-changing. But they're not looking at the whole body, right? They're not looking at the full picture. They're not looking at any underlying conditions that, if those aren't addressed, that peptide might not work at all. You might just be wasting your money. The hormones might not work at all. You might be wasting your money, or you might experience some benefit for a couple months, but then those benefits start to drop off and you're wondering why. You start to kind of lose faith or trust in peptide therapy or hormone therapy or whatever it might be, because you're going with a clinic or practice or a social media influencer that doesn't have the knowledge, that doesn't have the education to test instead of guessing, to treat the underlying condition while on these treatments, on these services that, like I said, are game changers.
And the worst thing is you don't just lose faith in or confidence in the doctor or the peptide or the supplement. You begin to lose belief that your body can actually heal. And that is the heart of the issue of, if you feel broken and hopeless and it's just my body can't heal, that is, I think, the worst thing that can happen, because then you are hopeless and it's like, why am I even here? Right. And that's a hard place to recover from. And it takes a team, it takes an effort to support a person like that. But I see that often, and I think that is the worst outcome, is my body just can't do it. My body doesn't have the capacity. So now everything is external, and that's the only thing. So we just search for thing to thing to thing to thing, but it's always been here. The ability, the innate, the intelligence, the capacity is always there. I even believe my dad, right? Diagnosed in July, died September. I believe his body was still trying to heal. It didn't lose that innate capacity, but the rate of disease was happening at such a fast pace, the rate of healing was not keeping up. And maybe if we look at it that perspective of, oh, where's the rate of disease versus the rate of my body's ability to heal? Hey, the ability's still there, but there's all these other confounding factors that are increasing that rate of disease. How do I pick away at those one at a time? And in his case, he lost the desire and kind of just, I'm kind of done. I gave up. When the doctors told him, you don't have to die from this. You can fight this. We just have to tackle things one by one. But he had already, the fire was lost in his eyes to fight.
It's unfortunate that happens to you, and my condolences to you and your family. But that happens, right? And it's happening to a lot of people. And part of the reason why I wanted to do this podcast is to hopefully this message, this podcast itself, right, comes across to that individual who might have lost hope, who tried the peptide because they saw the influencer said it worked, and then they gave up, right, because it didn't work for them, because it didn't truly treat the underlying comorbidities that resisted against them being able to benefit. And then they stopped seeking, they stopped looking for answers, because they just felt that there's nothing out there for them. They didn't find a functional medicine provider that knew how to address the concerns that once that is handled, like I said, going back to the supplement, the peptide, the hormone, you can see transformative benefits and results. So the question is that peptide right for me? The question is the method, is this provider doing me a service that then I can benefit from? Is really the message that I hope people listen to, because there is a path for you, right? I do believe everyone has the ability to heal. Are the journeys going to be the same? Hell no. They'll be very different. It's not going to be the next day. There is no such thing as a magic pill. It's going to be a process. If you're dealing with a chronic illness, chronic disease, think about all the years of the lifestyle that it took to create this illness or disease and what you have to do to rebuild that, right? There's one test that you mentioned, not on here, but that I read about. I think it's the MVX test. Talk to us about that, right? It sounds interesting. What is that designed to reveal that standard tests miss?
Yeah, so the MVX test was developed by NIH, and they were looking at to really have better outcomes with their cardiovascular patients, right? Because heart disease, how do we predict? How can we know if someone is susceptible to dying from whatever it might be? So the MVX stands for Metabolic Vulnerability Index, and that score gives you a relative risk of mortality in the next 5 years. It's the numbers that they use to get that score that really helps to identify what's going on in your health. So there are 6 markers that are used in this MVX plus test to get that MVX score. Sometimes that MVX number can scare people, and it's like, well, why do I want to know that? I said, because if you can know what's going on in your body, then we can work to uncover like the challenges. We can uncover the causes. So you've got 6 markers. The first 2, one is called glyc-A. This is a glycoprotein that is only activated by infection. So if that glyc-A is high, you can know, hey, there's some kind of infection, right? It could be parasitic, could be fungal, bacterial, viral, right? We don't know which one it is, but there's some infection. Small HDL particle is the second thing. And this is different than regular HDL. Small HDL, if we talk about cholesterol, HDL specifically as the military, we'll just say the Navy, then the small HDL particle is like the Navy SEALs. It's the elite force of these particles that are going deep into the tissues to scavenge, to grab onto the excess fat, the excess cholesterol, the excess circulating immune complexes that are causing disruption in the body and bring it back to the liver. If those are low, then your body's cleanup crew is very underwhelming. It is not doing its job. It's not cleaning up the environment. So your rate of disease is going to be faster than your rate of repair. The other 4 markers, citrate is one, and citrate is not the same as citric acid, right? Citrate is formed by a process within your cells. And that marker, when it is elevated, it indicates toxicity. You're being impacted by glyphosate, by herbicides, by pesticides, by biotoxin illness from mold. It's toxicity. And if it's low, it's an indication that your batteries in your body, known as the mitochondria, are depleted. And there's just nothing there to even make energy. And then the last 3 markers are amino acids, which they also play a role in these energy systems, these batteries, mitochondria in the body. And if they're high or low, they're giving you an insight into what is happening. So I utilize that test with every patient because, one, it's affordable, it's easy to get, it's actionable, and it can give you direction to understand, hey, what is my body working with right now? And so that's one of the first things that I offer. And actually, when I work with people, it's like the first test that we do to then evaluate and identify, okay, what's next? What's the path? And then we reevaluate that test about every 2 to 3 months to identify, are we on the right track? It keeps both of us honest, right? If it's not changing, there's an issue. Either you're not doing your work or I'm not doing mine right. And then we evaluate and we adjust. But it does change, right? In the interpretation of that, the understanding of how those numbers, what's happening, can really give great insight to, hey, this is what's changing. Your body's cleanup crew is getting better. This is why this HDL went up. Or Were you exposed to a toxin? Your citrate was normal and now it's sky high. So it really helps to understand and address. And so if there's any one test that I like to do at the very beginning, it's that one.
And is that done through a specific specialty lab, or can that be ran at a LabCorp request?
That's where it's not at LabCorp. The test is owned by professional co-op, but they're all administered through LabCorp. So pretty much almost everyone has access to a LabCorp.
Yeah, I think we're partners with LabCorp. So if you live close to our clinic, obviously you can come get labs drawn at a clinic that we then send to LabCorp, or we just send to our clients to the 2,200 draw sites, within the country. I mean, to your point, they're everywhere.
Which is what I do. I send them a link, and we order the test for them. They go to take the test, we get the results, and then we do either a consult with new people or with the people I'm working with. It's like, hey, let's evaluate what's been happening.
Yeah, I have an interesting question because I know we deal with that all the time, but some of the conditions that you treat and that we treat are often contested in the eyes of mainstream medicine. When a skeptic challenges your approach in this kind of medicine, how do you respond?
That's a good question. I think first I want to understand what's your point of view. Like why? Like where are you coming from? What does health mean to you? And where does health come from? Where does it originate? Is it within the body? Is it without? Like, I need to know where are you at with that. And then often like this, I see this with dynamic relationship in marriage, right? Oftentimes the women are the ones that are seeking out health, and their husbands are like, what's wrong? Just eat less and exercise more, which is not an answer. A terrible thing to say. But I've had this conversation, and it's like, well, let me ask you, like, what have you guys tried? And they'll reel off, like, we've done this and this and this and this and this. And I'm like, and where are you? We're nowhere. We're just spending tons of money, and it doesn't seem like she's getting better. Like, okay. So are you open to looking at it from a new perspective? And sometimes there's some hem and hawing over that. But it's like, you know what? I don't know what else to do. So, okay, what do you got for me? And then I think it's education. It's an understanding of, one, do you believe that we're exposed to toxins on this earth? Basic question, right? Herbicides, pesticides, heavy metals. And there's usually like well, yeah, I mean, I know that we're exposed to stuff. Okay. Could that affect you differently than it does your wife, or your husband different than does it affect you? Can it affect you differently? Probably. Yeah, we're different people. So I think it's educating and then trying to understand their perspective, because a lot of times it's more fear and not wanting to be taken, right? There's been a lot of gaslighting in the health space. And if we can establish a relationship of trust and rapport, and then be able to educate, here's how these things impact the body. Here is my approach. Here's where we start the sequence. This is why. If you're calm and able to explain that in a way where you're not defensive, where you're not the aggressor, people are really open to that. And they sense that. It's not about facts and figures. It's not about proving through blood work or tests. People can see tests and their tests to identify toxicity, but it's still like, well, I'm fine, she's not. What's the deal? But if we can have a conversation where I'm not triggered and I'm not now defensive and trying to prove, but just have a conversation, man, that goes a long way. And it's trust, right? Is this a foolproof system? No. Is there a hypothesis of this is why I think this is happening? This is what I'm going to do, and this is how I'm going to support you through that. Oh, okay. I'm getting support. I think that's another big reason why people don't trust in this space, because they're given a protocol and then told, come back in 3 months. And if it doesn't work, it's often, well, you didn't do it right. Okay, but there was no, how do you know? So it's basic human needs. We want to be heard. We want to be seen. We want to be listened to, being heard, right? And if we can build that trust, I think that goes a long way. And honestly, we all want the same thing. Maybe we go about it in different ways. But if I can trust you and you can trust me, then you know what? Let's engage and let's actually do this. And the minute that trust is broken, right? The minute you don't respond or you blame, then that brings up red flags. So I think it's really coming from a place of being grounded, being clear, being loving, and having compassion for what their point of view is. That was a long-winded way of answering that question, but yeah.
No, it was very thoughtful, methodical, and it's something that, constantly is being addressed, even though it's becoming more and more mainstream, and functional medicine, longevity medicine, whatever you might want to call it, it's still so new to people that we got to have the conversation, right? We got to be willing to understand that they have a perspective and we have a perspective, and we are both allowed to have that, right? We can both have a seat at the table, having different perspectives, but and there's nothing wrong with that. Whether you want to believe what we believe, that's fine. We can lead a horse to water, but we can't make them drink, right? That's going to be to them. But all right, I got a couple of rapid fire questions before I close it out. First one belief about health most people get wrong.
That health is outside of you. It's not. It's all inside.
Yeah. One daily habit that you never skip.
Sunlight in the morning.
Finish this sentence. Your symptoms are not a life sentence. They are
an opportunity to learn, an opportunity to listen.
And when it's all said and done, what do you hope for your legacy to be remembered by?
That people knew that they were seen, that they were heard, and that we were able to work together through that.
Dr. Randy, it's been a pleasure. I really, enjoyed this conversation. It's a conversation that I can have all day, right? Very passionate on it. I think it can help so many people. And you have helped so many people who have run out of answers. They found their way back to their health, one root cause at a time, and you were a part of that. But also, I want people to also understand that they are doing the work, right? It's not what we do at Nava. It's not what you do at your practice. It's how they take what we give them and how they apply it, how they really commit to themselves. So I've really enjoyed this conversation. It's resonated with me. I'm sure it's going to resonate with a lot of people. So to all the listeners, viewers, if this was impactful for you, if you know someone who needs to hear it, listen, share it, sit with this. Somewhere in today's conversation may be the question that no one ever thought to ask you. So Dr. Randy, thank you for being here.
Thank you. So appreciate the conversation, the questions. It was just a delight to have a conversation with you.
If today's conversation sparked something in you, here's what I want you to do right now. Pick one strategy, one insight, one small action you heard today, and commit to it this week. Excellence isn't built in moments. It's built in the daily decisions that compound over time. Remember, you're not just building a healthier body or a more successful career. You're building a legacy that will outlast you. And that starts with the standards you set today. Thanks for listening to the Legacy and Longevity Podcast. If this episode was valuable, first subscribe so you never miss an episode. Then leave us a review to help more people find these conversations. And finally, share it with someone who you think needs to hear it. Until next Tuesday, keep raising the bar, keep pushing your limits, and keep stacking days. I'm Zach Dancel. Your legacy starts now.